Yeah, let's kick it off. Hi, everybody. Thank you so much for joining us. I'm really excited to offer these tools out for everybody for when your campers are getting ready to go to camp. Sometimes there's some jitters, sometimes there's some strong feelings, and we are very lucky to have some camp alumni and parents of current campers. And one is actually our mental health director, the Blumkin brothers, Zack and Josh, and they are going to talk to us a little bit about how we handle anxiety and pre-camp jitters at camp. And Zack is actually going to talk about it a little bit from a clinical psychological perspective. So without any further ado, Zack, why don't you kick it off?
All right, thanks, Mitch. And it's so nice to see familiar faces and names joining us today. I will try to be light and easy and quick as well. But if anybody has questions or any concerns as we go through, feel free to unmute and holler it out, or you can chat Blair or chat Mitch or whoever. But it's so nice to see folks again and welcome. So I'm going to try to get through all of this material. And I guess I'll start with maybe just a little bit of what we call psychoeducation on where anxiety comes from. So I do like talking about this primarily because the idea behind reducing the stigma of mental health. If we were giving this talk on maybe food allergies, or we were giving it on other health or medical issues like maybe cancer or sickle cell anemia or diabetes, we wouldn't necessarily need to justify the reason why we're giving it or talk about mental health. But I think we still have a ways to go from destigmatizing the idea behind mental health. So there is a biological basis for mental health issues, and anxiety in particular has a relationship with the amygdala. And so one way that we can just think about it is that sometimes amygdala is a part of the brain that really helps us with that fight, flight, or freeze response can be overactive in some folks. And when it's overactive, that means that maybe we feel a heightened anxiety or fear response to certain situations. And so when we're thinking about that, we want to remember that if this is biological, that means some of us don't necessarily have a ton of control in that moment when we're facing difficult situations. And certainly going away to camp for your first time, or maybe going away for your second time, or maybe going away for the full 7 weeks, for folks who have some of that anxiety, this could be difficult for them, and really supporting them in this journey and teaching them skills and strategies to build that resilience so that later in life they can take this skill and generalize it could be a really nice moment. And so recognizing that when we're talking about maybe the amygdala and it being overactive, we're also thinking about different characteristics within the brain. So we might be thinking about size of different parts of the brain, like the amygdala, or we could be thinking about structure, or we could even be thinking about how it interacts with other parts of the brain so it's kind of function. And I know it's a little bit nerdy, and this is the last thing that we'll talk about, but here's an actual slide where you see somebody on the left, right? It's three different individuals, and somebody on the left who has and reports having more anxiety than other folks and suffers from an anxiety disorder. You actually see parts of their brain light up when they're facing stimuli that's anxiety provoking for them, and other folks don't necessarily respond that way. So really recognizing that anxiety and other mental health issues are very real, right? And I think we've done a good job. We've come a long way, especially through the pandemic. And I think from well-known individuals talking about mental health issues being real. And this has been sort of something that's really important. But I do just want to highlight that it's real, and that when our kids are suffering it and our family members and loved one, they're suffering from something that is the same as other health issues, and we just want to take it seriously. And that's why we're all here, and I love it that we have so many folks who have joined us today. So anxiety is also normal, and normal for many folks. And actually, it's one of the most common mental health issues that we see in children and teens, comprising that approximately 10% of children ages 3 to 17 are diagnosed with an anxiety disorder, which is pretty high, and actually the highest out of the groupings that we think about. Anxiety can also be really helpful when we're talking about increasing your awareness or alertness. So if you think about maybe giving a presentation or engaging in sports or doing a play or whatever it might be, it can actually help you be a little bit more alert, which is a good thing about anxiety. It can also cause a physiological response that improves your performance. So I'm thinking about taking in more oxygen and then being able to run faster in that moment. It can help sharpen your focus as well, which we'll talk a little bit about. And so that can be helpful as well when we think about anxiety is not only normal, but helpful. Anxiety, understandably about where it kind of comes from, it can help motivate us to act, right? So if we think about the origins of anxiety, if I'm sort of sitting in a cave and I got my nuts and my berries and all of a sudden I see a saber-toothed tiger, it can motivate me to get up, maybe to fight or maybe to run or maybe to hide and freeze in some way. So it can motivate us to act. Also, what I sort of alluded to earlier, when we have some anxiety and we learn skills and strategies to work through that anxiety, we can actually build resilience and confidence in handling situations in the future. And that generalization can be so helpful. And I want us to think about that's how we want to kind of instill and support some of our young folks and even some of the young folks who might be on the call. Another thing to think about is having anxiety can allow you to have more empathy and understanding for what other people might be going through, and even that increased social awareness. So just like we have it with the Inside Out 2 little diagram right there, a picture, we just want to think about anxiety can be used and is an important part of our lives. And so I'll come back to this idea, but the point isn't to remove all of anxiety from our experience, because that's not a likely outcome for any of us. It's more of how do we know what anxiety is typical, what is atypical, and then how do we respond to the anxiety that's maybe atypical to build that strength. So this slide jumps into that a little bit more, right? And if you see that column under that yellow column right there, we got to see anxiety that is really normal, that most of us have sort of felt at some point in our lives. And then on the other slide, we see kind of those anxiety disorders where it may come out of nowhere or it really feels very, very intense. It lasts for a long time. It interferes maybe with social relationships, maybe interferes with academics, maybe it interferes with engaging in extracurricular activities. And maybe there's a lot of physical symptoms, like a lot of them, as well if it feels like it's really out of control and I can't manage it. That's really when we see that blue column, we're going to want to intervene in a pretty significant way. And coming back to the very first slide, without judgment, right? This is not something that somebody's necessarily able to control in this moment. So let's teach them skills and strategies so they can learn how to control that. And so sometimes people ask, well, how can I tell if my child or a young person I'm working with or somebody that I care about is presenting with anxiety? So there's pretty specific and classic, what I would call kind of verbal cues, right? You're looking for that excessive worrying. There's a lot of worrying. It's going on and on and on. There's a lot of negative statements about an anxiety provoking event. And you can think about, well, they like engaging in that sport or they like doing performances or being in the play or playing an instrument. But when it comes to that moment to get up on stage or to get out on the field or whatever it is, there's a lot of negative statements about the event and not wanting to do it. There can also be a lot of repetitive questions. Where are you going to be sitting? Are you going to be over there? How am I going to know? What if I lose you? How am I going to find you? Where are you going to be? All these repetitive questions. These are sort of verbal cues that in this moment, anxiety is kind of getting a little bit out of control. We also see pretty classic behavioral cues, clinging, withdrawing, physical symptoms. These can all be signs of anxiety and things that are going on. And then, of course, other classic symptoms could be sort of having pretty severe nightmares and ongoing nightmares or significant attempts to avoid certain situations or sort of certain experiences that might be anxiety provoking. And then maybe some significant changes in mood. Some signs that may not be as apparent and could come up for us as we send our kids to camp in the upcoming weeks and months would be maybe seeing some anger that you haven't seen before, that is pretty new and it's a little bit unexpected. You might also see some difficulty sleeping. That can be related to anxiety. A big one that we miss with a lot of young folks as well is kind of some of that oppositional or defiant behavior, the no's, no, 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 right? We sometimes think of, well, that they're just being difficult when maybe actually the underlying issue is they're not feeling really comfortable about an experience that they're going to face. The lack of focus or difficulty paying attention, anxiety can get in the way because we're caught in our thoughts, we're a little bit stuck, we're having trouble getting out. I already talked about the negativity and a little bit of that over planning, right? So these are all signs noting that, some of this is biological, some of this we can't control, some of this is normal, and some of this actually can be helpful. So, what are general approaches we want to take? Well, again, the idea is not to eliminate anxiety. And as parents and loved ones and professionals, that can be sometimes a hard one to grasp and accept. But it's really important to remember that we as human beings, since the beginning of time, right, we've experienced anxiety and we're probably going to continue to experience it. So it's really about managing that anxiety, not fully eliminating it. We want to take our children's concerns really seriously. It's really important that we don't brush it off. And one of the ways, and sort of a skill that I talk about over and over and over again with the families that I'm working with and the different folks that I work with, is this idea of validation, right? And validation is a really, really important skill that we can utilize with our loved ones to communicate we're taking them very seriously. A lot of people get validation mixed up with praise. Praise is, hey, Mitch, you're doing an amazing job with Chateaugay, which you are, by the way, Mitch, right? But that's praise. Validation is communicating to someone that you understand how they're feeling, you understand how they're thinking, and you might even understand why they engaged in certain behavior. Validation doesn't necessarily mean you agree with them, it just means you see them. Sometimes, as parents and loved ones, it's kind of hard to do validation because when we do validation, we got to go to a place where we see them feeling really anxious and we sit with the anxiety. We don't try to change it. We don't try to make it better. We don't try to tell them why they're thinking about it in the wrong way, right? We really sit with it. I absolutely love this book. It's a children's book. I have it and I read it to all three of my boys. It's called The Rabbit Listen. It gives you a really, really good example of what validation can look like and what we as parents can strive for when we're trying to practice validation. It's also a skill that I know Josh, Mitch, the whole team uses a lot at Chateaugay in a way to really support their kids while they're at camp. In addition to validation, we really want to be mindful of how we're communicating and responding. We're not shutting down. We're not getting angry. We're controlling our own emotions, which I'll talk about in a little bit, but really being mindful of being supportive in that moment and being okay with sitting with some of their anxiety, right? The last piece is expressing positive but realistic expectations. So meaning I wouldn't want somebody to tell their child who's going to camp for the first time, you are going to have an amazing time every single day, because they're not. Some days they're going to have tough days. However, we can say, I know you got this. You're going to find a lot of fun activities that you're going to want to do. I really think that this is going to be a good time. And if you face a tough day, like a cold pool or a rainy day, I know you got this, right? So this is about being realistic and not selling something that probably isn't going to really happen. We also want to be supportive and encourage your child tolerating that anxiety, and then trying to keep this sort of anticipatory period of what's going to happen short. And we'll talk more about that as it relates to going to camp. But one thing that you can think of, and I'm doing some foreshadowing, is kind of that drop-off experience, right? So really trying to keep that short and sweet. And I want to say, you have to take all of this kind of advice and build it into the culture and the values that your family. So if it doesn't fit, you're obviously welcome to throw it out. But for the most part, keeping that sort of drop off crisp, clean, quick, and getting out is usually good for anxious ones instead of kind of elongating that period, right? Think through these situations with your children. And we're going to talk more about this from the perspective of camp as well. But try to think through, how are they going to cope with it? What do you think is going to be difficult? What do you think is going to be really fun? And also really important, and I don't know that we always do this, or I should say I'll call myself out. I always do this, but modeling healthy ways of coping with difficult situations. So over the next couple of weeks, right? Really modeling that you're handling the anxiety about sending your child away, right? And I'll give it a little example. My oldest, who goes to camp, I'm not going to share a lot of his examples because he's kind of a private dude, but I can say when I dropped him off, right? I was cool as can be, made it quick, said bye, fist bump, I'm out. And then I bawled basically the next 2 hours as I'm driving home. So sad that I'm leaving him for the first time, but really modeling in front of him that you got this, we're confident, and I'm not in that moment kind of going to give into that, right? And want to really just demonstrate that for him. When we're thinking about anxiety, we want to make sure that we're not avoiding, right? So we want to avoid avoiding. So we don't want to avoid things in this moment. So meaning if they're saying, I don't want to talk about camp at all, I don't want to, I'm fine, it'll be okay. That could be a sort of a message of avoidance because they don't want to approach it and it's too anxiety provoking. And we're going to have some conversation about camp. We're going to have to pick out what clothes you're going to wear. We're going to have to answer those questions online about what you're interested in, what you're doing, right? We're going to have to talk about, are you going to want letters? Are you going to want this and that and that? So you're going to want to make sure you're avoiding. You're also not going to want to do reassurance seeking if they're asking a lot of questions. If I'm not happy 48 hours, will you pick me up? Will you make sure you call me every day? Will you do this? If there's a lot of those questions, we want to respond once, we want to respond twice, and after that, we're moving on. And then I think sometimes, and without shaming you all, right, we can respond with parents with some sort of shame response because we're feeling like it's overwhelmed. It's like, why would you even ask that? Yes, of course you're going to be safe. Yes, you're going to like everyone. It's going to be fine. Making sure we're avoiding those types of responses to our children, which can lead to difficult moments. As we're kind of communicating with them about this really new experience for them. So we really want to focus on a really open space to talk about what are you nervous about? What are you worried about? What are you not really looking forward to? Right? Being there, having that conversation and allowing that conversation to happen can help reassure them and reduce their anxiety by just having that one time. And again, we're not going to want to do that reassurance seeking where we're having the conversation over and over again, but having it once and getting it out can be really helpful. Again, validating their feelings in that moment. We do want to focus camp as fun because that's what it is. And I see so many names of former campers on this. Like, we're here because it was fun. We loved it and we think they're going to love it too. So really focusing on not the fact that, yes, you're anxious about this. And we can also talk about what are you really excited to do, right? What are you really excited to experience? Also, doing some preparation and being involved in it can be really helpful. So, thinking about giving them autonomy and control and camp gear. And I can't remember if I talked about this, but I guess I am going to a little bit of sharing. My 10-year-old went online, we went on Amazon to pick out some of the bedding. No joke, he picked the most ugly, grossest sort of bedding that I'd ever seen. And I was like, dude, do you really want this? And he was like, yeah, I want it. I was like, all right, fine, we're gonna get it. It's like a PlayStation themed weird blanket or whatever. And he picked it and he got it. That's cool. So to a degree, that's appropriate, really giving them as much autonomy and control when we're traveling. Do you want to take the bus? Do you want me to drive? Where are we going to stop? What is it going to look like? Right? So really fitting in with that, but trying to giving them that autonomy. If you have an anxious kid, practicing the separations could be helpful. Even doing a role play of what it's going to look like. Hey, I'm going to help you unpack, or I'm not going to help you unpack. We're going to do this, we're going to do that, right? And then we're moving on. So going through that a few times can make them feel more comfortable when that time comes. Packing familiar items can be helpful so that they can feel more comfortable in that moment, whether it be pictures or it could be books, it could be a t-shirt, it could be a stuffed animal, whatever it might be. That's just something to think about. And then again, asking and keeping it open and modeling. We can talk about things that make you anxious. That's okay. And we can work through this. We can also talk about different strategies like role playing. Well, what makes you nervous? I'm nervous about meeting someone new. All right, let's talk about it. Let's talk about how we're going to do this. What would it look like? Let's role play a little bit. Let's work through it, right? And also, just so you know, they're going to do a lot of icebreakers. There's a lot of things that are going to happen where it's sort of organically you're going to meet these folks. So really thinking this through, not only through role playing, but visualizing what it's going to happen and practicing this sort of positive self-talk of you got this, right? You're going to make through this. And sort of, I feel like I'm going to be a little lonely and I know I can make new friends. If you're really feeling nervous and you got a child that struggles with a lot of anxiety, and again, we know it happens, we know it's biological, Chateaugay, and I'm sure other camps as well, have set up a really nice system, many of them, and I know Chateaugay for sure, that's the only one I can speak to, right? We have camper advocates, we have director of mental health, we got Mitch, we got so many folks that are involved. Talk to them, help them get involved so they know what's happening, right? And also remembering that we need to manage our anxiety, not only when we're with our children, but on our own. Because sometimes when we think we're not showing it for our children, it's sort of it's oozing out a little bit. So it is really important that we are managing our own anxiety and also being mindful of what we would call accommodations. Accommodations are really important in the way that accommodations can help kids who are struggling in that moment kind of get to their goal. And we just want to be aware of what accommodations we're giving our children as we're setting them up for camp. So making sure that we're not doing too many accommodations, because when the time comes and they get removed, we might actually have a kid who's doing a little bit worse. So being mindful of, are you changing your child's schedule in a certain way because of their anxiety? We're going to want to try to reduce that as much as possible, right? Are we buying them things or providing them items because they'll need it for their anxiety? We're also going to want to reduce that as much as possible. A really concrete example of that is like if they need a specific certain item to get through a situation, right? How can we remove that item little by little so that we can show them they don't actually need that item to get through that and they can do it themselves? Again, building that resilience, building that confidence, and even the self-efficacy of that specific situation, right? We want to make sure we're not providing that reassurance or answering questions over and over again. And also, we're not engaging in the actions because they're engaging in avoidance. And again, another example is there's questions that they have to answer so that we can get to know them better. And folks at Chateaugay, I should say, so Mitch and his team can get to know them better, right? If they're feeling too anxious about this, we really want to take a step back, work with them so that they can truly answer that and we're not doing it for them. That would be really important. And last year when I did this talk, I didn't talk as much about parents, and I felt like I wanted to shift it a little bit more. But this is really a lot about us as parents and how we manage our own emotions. And we actually know that when we manage our own emotions, it can actually lead to more regulation in our kids. And that's pretty understandable. If they're not very calm and I can stay calm and validate them, it's going to increase the chances that they're actually going to become more calm, right? And so one of the ways I can do it is listen to the emotion instead of worrying about the behavior, instead of worrying about the content of what they're saying, really trying to see them. And it's the idea that we need to do maybe a little bit more than just validation, but also make sure that we as parents are staying regulated. And so I think that's the take home from this part, which is parents is really, really important that we try to stay regulated as well. Just got a few more slides and then Joshy, I'll pass it over to you. Some things that campers can do. Work with them to construct a plan of what are they going to do if you're feeling anxious? Who are you going to go to? What are you going to talk to? How are we going to handle this? Let's practice that plan a few times in the home and then review it. Was it helpful or was it not? Right? And obviously, if it involves screams, that's something that's not going to be a possibility at camp. So we're going to have to amend the plan, write the plan down. And if there's significant anxiety or if you think it would be helpful, share it with Josh, share it with Mitch, share it with the team so that they can support that plan and utilize that plan while they're at camp. It can sort of include this idea that there might be a signal that they can give like this, or even going up to a counselor and letting them know, hey, I'm not feeling so great right now. Awesome. We'll utilize that plan right now. There's campfire players, which I think are allowed at camp. There's fidget toys, squeeze balls, photos, anything that can help them re-regulate in that moment, and we can kind of set that off. And again, a lot of this really involves kind of practicing this at home and preparing a little bit and just making sure that the plan is actually effective. All right. Other coping strategies that I really encourage all parents to look into, you do sort of some paced breathing or progressive muscle relaxation, or even do some of what we call cognitive restructuring, all of which honestly you could just go on YouTube and find some good videos and then work with your child to kind of see, hey, do you think this would be helpful or that would be helpful? And if it's not, that's cool, throw it out and try something new. But these are all different plans that we can do. I'm going to very quickly just talk about homesickness. because it happens at camp. I'm sure it's happened to many of the folks who've been on the call who went to camp. It really is kind of understandable. The prevalence is actually a little bit complicated. In some studies, it shows that it's up to like 95% for individuals who leave home. And that's not just kids, that's also kind of young adults who go away to college. But it really probably is around 20%, which is kind of high, 1 in 5 of all genders from individuals who leave away from home or feeling kind of moderately severe sickness, excuse me. So really highlighting homesickness is normal. And feeling homesickness doesn't mean that your child isn't having a good time. And it doesn't mean that the camp isn't a good fit. It just means that they're feeling a really normal and understandable experience. And so we also want to acknowledge that it does fade over time, right? And as they become more busy with activities, with the routine, making friends, kind of settling in, we see it decrease pretty significantly. So we as parents, how can we kind of help? Well, one is if we think, and you all know your children better than we do, obviously, and you know your children better than anybody, you're the experts. If you think you have a young one who's going to be homesick, talk to them about it. Let them know it's okay to feel that way, right? Talk to them about different skills and strategies that they might feel when they're homesick. And in a very similar way, you can follow an idea of like, okay, let's come up with a plan. Who are you going to tell and what are you going to do in that moment? Right? You can also talk to them about, well, let's talk about how I can stay connected with you. That's not going to make you feel more homesick, which might require some pivoting in camp, meaning if the letters are actually making you feel a little bit worse, maybe they're not going to come or the emails as frequently. But thinking through a plan of what might work, and again, what side of skills and strategies that we talked about as it relates to anxiety can be generalized to homesickness. And just acknowledging this is a part of growing up. And as I said, with kind of those rates, it's pretty common for folks. And when it's going on, we really want to encourage our children to throw themselves into those camp activities that are so fun, meet new people, meet new friends, try new things, encourage them to talk to their camp counselor, to talk to their amazing unit leaders. Obviously, we have camper advocates at Chateaugay if needed, but really coming to this idea that what I'm going to try to do is validate that you're feeling homesick. I understand that you're missing home. It makes a lot of sense. I love you very much, and I really want you to focus on the activities you're going to do this afternoon. Breaking it down into different just kind of days and components can also be helpful for them to kind of fully engage. So I know I went quickly. I didn't want to bore folks. I wanted to get through it. But hopefully these skills and strategies will kind of help folks. We're going to have the slides available, but these are kind of give you ideas on how you can best support your young ones as we send them off to the amazing place that we call Chateaugay in summer camp. With that, I can pass it off, I think, to Josh.
Do you want to answer questions now or after Josh's presentation?
Whatever makes sense, Blair. Or, Josh, what's your preference?
Oh, sorry. There you go, Josh.
Thank you. No, why don't you answer some questions and then I can answer questions afterwards.
Blair, I don't see it. The only question I see, um, something
Yeah,
about
there's one in the chat.
Ninja Turtles.
Oh, maybe it wasn't a question, just a comment.
I'm gonna send some comics.
Yeah.
I love that. I love that idea of sending comics. You know, again, sending distracting. I think something that we're gonna do is we're gonna send a lot more books, and like playful books, fun books. But I love that example. Josh, I can pass it to you.
Okay. Thank you. Thank you very much. And I was gonna not embarrass you at all, but then you called me Joshy, so I'm gonna mention that Zach brought some hideous Teenage Mutant Ninja Turtle bedding as back in the day. But anyhow, Blair, are you able to share that? It's just a very short slide deck presentation. Do you want me to try to pull it up?
Yes. Mitch, do you have it on you? I can.
So thank you, Mr. Blair. So Josh Blumkin, I've been This is like my 23rd, 24th summer at Chateaugay. I was a camper, counselor. I've done just about every job, and I am incredibly grateful to Mitch for coming up with the idea that we needed some more mental health support at Chateaugay. So started in 23, coming back as a full-time support as the mental health director, and it's been a great experience for me, and the need for it is tremendous. Truthfully, I wish I had that support when I was there at camp. So if you just want to go to the first slide, I'm just going to talk very briefly about some of the things we do before camp and some of the things we do um, during camp to help support the campers. Um, I- Everything Zach said, I just wish I could take that presentation and give it to the counselors, because it's so well written and well stated. So just talking a little bit about some of the pre-camp supports. I connect with parents and I connect with campers. I'm happy to do this. The best way for you to get in touch with me is to reach out to Mitch, Blaine, or Blair, and they can forward that to my camp email. I am actually, my last day of school is the first day of camp. So talking about anxiety, that's providing me with some anxiety, but I will definitely reach out and get in touch with you to talk about how I can help support your camper, how we can help support the campers as they come in. I can connect with outside therapists. I've connected with school personnel, whether it's teachers, social workers, school psychologists, anything to help promote, a better time at camp and the most comfortable time at camp for your children. In addition to that, we can create and camper comfort plans, just talking about whatever the needs are, whether it's anxiety, ADHD, anything that we can do that needs to help support the campers. We can create some little camper comfort plans. We share it with the unit leaders, explain it to the counselors so that they're able to put them into place and to implement them really well. And then the training that we do for staff is tremendous. We have a behavioral specialist this year in addition to myself. She's BCBA trained, for those of you that are familiar with that. And so her and I are working very closely to talk about anxiety, ADHD, and other mental health needs, in addition to behavior education. I very much believe that one of the greatest things about camp is that they're learning how to interact, how to behave, and how to learn how to interact with other peers their age and older peers, kids younger than them, without their parents there. It's just one of the best things that I think about camp. And so when we're teaching the counselors, I talk about it, behavior education. It's not management. We're trying to teach these campers and promote, better skills for them. In addition to that, we provide instruction to staff for individual support skills that they can utilize for all campers, or specific campers, whether it's through the camper comfort plans or just sort of generally speaking. We talked about trauma-informed care. We do some de-escalation techniques, grounded techniques like 5, 4, 3, 2, 1, or some of the breathing exercises, some of the stuff that Zach was talking about. We also get into active listening, which really is promoting that validation and acceptance that Zach was talking about earlier. And that anxiety, having anxiety versus that anxiety disorder slide is tremendous, and that's something that we definitely try to incorporate into camp and into the training, because learning to cope with that is just such a great strategy, or it's not a great strategy, a great skill for the campers and all the children to learn. If we can go to the next slide, please. Thank you. So in addition, to all the pre-camp work that we do during camp, I provide counselors with specific skill training. I do some on-hand support with the counselors based on the individual camper's needs. So I'm like modeling what this skill looks like in real time, trying to provide that support for the counselors. Sometimes the counselors just might need a little bit of a break and they'll need myself or the behavioral specialist, Christina, to come in and support them. Unit leaders are a great connection with parents, and they give you continued, kind of information throughout the summer. I'm not exactly sure of how often they're supposed to be responding to you, but the unit leaders are a great asset for you in terms of in terms of connecting with your children. We promote positive reinforcement and interventions with the counselors so that they are working on that with their campers. And then I'm not going to be providing any sort of therapeutic counseling support, but I can provide what I call non-therapeutic counseling support for campers, just if they need to let some steam out or anything like that. I'm not going to be practicing CBT or DBT or anything like on that level, but just giving them an outlet for them when they're in need is definitely something that we have been able to set up. Mitch has created a space, a safe space room in the big house for campers to both connect with their outside therapists, if that is something you choose to do throughout the summer, or also to work with me or Christina if they need that kind of one-to-one private area to calm down. Sometimes I've had campers just go up there and they're just sitting. We're not even talking. They just need a little bit of a break away from things. And so we're able to do a lot of that stuff, which I think Mitch deserves a ton of kudos for that in terms of having the vision to see this and giving me some of these things like the safe space room to make it happen in a really effective way. I don't really have anything else to add. I think Zach did a phenomenal job with it. I'm happy to answer questions, and I know that Zach can answer questions if you have specific camp stuff. Happy to share out. And also, it's great to see so many familiar faces out there. So
I'm gonna let everyone take themselves off mute if they want to ask a question or ask anything.
Hi, I have a quick question about the bunk arrangements.
Sure, fire away.
How many people are usually in one bunk?
Wait, what is your name? You look very familiar.
I'm Chloe.
Hi, Chloe. What's happening? I first of all, I think you are so brave for being on here and asking the first question. And that was you that wrote about you have little anxiety about people not knowing you, right?
Yeah.
Yeah. So there's about anywhere from 8 to 12 campers in a bunk, and there's 2 counselors, and they live in there with you, and they're like college age. They're kind of like big sisters. And there's also a unit leader. And then there's Josh, and there's Christina, and there's a lot of grownups there that are always paying attention to make sure that you're being really well taken care of and that you're being supported. But, we do on the very first day that you get there, there are name games, there are icebreakers. We do all kinds of fun things. There's like skits that the head staff put on at the dining hall. So we really make it fun and we really make it easy for people to know each other, because you're not the only person. Even people that have been at camp before still feel anxiety, and it's new. It's a change, and that's very normal and very natural. So I'm so proud of you for asking and for saying something. And if you continue to have feelings of anxiety, let us know. We'll really help you.
I have one more question. I have medications and prescriptions I take every day. What would I do in that situation?
There is this amazing building called the Pillbox. That's our fun name for our health center. And there are 3 nurses and a doctor there all the time. And we have, it's pretty much a routine. Like, we find out when you take your meds and what they are. And we have it all organized so that it's very easy. It's right by the place where we do all of our announcements and we eat all of our meals. It's called the Big House. So it's super easy. And by the way, if you miss taking a med, the nurses will come and they'll make sure that you get it.
Okay.
Okay.
Thank you.
Great questions. Anybody else?
Chloe, I love the questions, and I can't wait to meet you in person at camp. All right. So when I get there the first or second day, will you make sure to say hi?
Yeah.
Awesome.
Way to go, Chloe. Anybody else?
Marissa has a question.
Just wanted to say hi and thank you. Hi, Josh. Hi, Zach. This is really helpful. My daughter's very anxious. I think she's going to love camp, but just preparing for this, it's just really nice to hear from you, and you took the time to prepare this. It means a lot. So thank you.
Awesome.
Thank you.
It's great to see you, Marissa.
Good to see you.
So listen, Zach, Josh, Blair. I don't know if you guys met Blair. Blair is our camper experience director, and Blaine could not join us this evening, and Candy could not join us. But that's our main core team. So Zach, Zach was like the 2-year-old in the Big House, his first summer at camp, and wow, you're an inspiration, my brother. I really greatly appreciate it. That was so clear and so concise. Thank you so much for that. And Josh, Josh and I have our communication has been a lot over the last few days. When you say last couple of weeks, it's really ramped up. And I said last summer, as Josh and I were, we spent a lot of time together over the summer, really making sure everybody's having a good time. And I said, Josh, it's so fun. We went to camp together when we were kids, and now we're doing this for other kids. It's just great. It's always great to see you guys. So,
well, Mitch, if I can just say, I mean, I think it's so awesome that Chateaugay takes it this seriously, and the way that you're helping kids these days, it's so important. So from the mental health perspective, I'm just so happy that you're all doing this, and you do such a great job with Josh and his team and how seriously you take it. So thank you.
You're very welcome. Thank you.
And thanks everybody for coming. And Chloe, thank you for coming. You're awesome.
Yeah. Thanks, everybody. Anything else before we sign off? Anything in the chat?
Mitch, it's Rebecca Hanley. Hi,
Rebecca.
how are you?
Good.
It's so nice to see you guys and see faces. We do not know one another yet. Obviously I know Mitch, but my son is 10 and he'll be a rising 5th grader coming to Chateaugay for the first time. I have a non-anxiety related question. Is it better for me to email?
I mean, why not? Right here.
Okay. Just so the visiting day for on I think it's maybe July 19th, and then pick up for first session is Sunday, July 20th.
Correct.
So is that visiting day? I'm assuming that's not for the first session only, kids.
It is only for the first session. The second session campers get there in the afternoon of the 20th.
Oh, okay.
So, well, this first session or full summer kids would be visiting day.
Okay, got it.
Does that make sense?
Yeah.
All right, cool.
Mitch, I have a question.
Yes.
Do you guys celebrate birthdays at Camp Chateaugay?
It's Victor, right?
Uh-huh.
Victor, we do. And you know what? My birthday is at camp, and it's always been at camp my whole life. So we do. Yeah. Birthdays are super fun at camp. You get a big cake. The whole dining hall sings for you. We have these fun traditions. You get like an ice cream party. We sing all kinds of songs. It's funny. My youngest daughter just had her 5th birthday party, and we sang the birthday songs. And there's like 3 of them, and they go on for a while. And everybody at the party was like, "What are these people doing?" And we kept singing and singing. It's really fun. Great question.
I think Heather, you had raised her hand as well.
I did. Thank you so much. This has been so helpful and comforting. I love the idea of a camper comfort plan. So if we wanted to create one for our camper, how should we go about that?
Josh, what do you think? Where's that?
So yeah, the easiest way for you to contact me, because I don't think my email is advertised is to reach out to Mitch, Blaine, or Blair. But you can reach me directly at mentalhealth@chateaugay.com and just say, hey, can we talk about this? And I will reach out to you. As I just like to preface, because it is a busy time of the year at the end of the year, I definitely will get to it. But it's not, and I'll respond to emails very quickly, but in terms of meeting up with people, it might take a week or two. But I would love to be happy to set one up with you.
Yeah, Heather, I think it's my approach to all of this stuff is really getting ahead of any potential issues and communicating them well in advance is I'm a huge fan of. So whether it's emailing me or emailing Blair, emailing Josh, let us know. We'll help you come up with a great plan. This is what we do. So it's not that tough for us, and we'd be happy to do that. And then it'll be in place, and there won't be any issues.
Great, thank you.
Of course. Chloe.
Sorry. Oh, yes. How do you communicate with the parents and the emails and the letters and that stuff?
Sure. There is a great app that parents can download called the Companion app, Companion. And there's a feature in there where you can send messages, just like, sending in a message on Instagram or on Facebook or something.
Since we don't have these devices to communicate on, how do we get the message?
Yeah, great question. So if your parents send you a message, then it gets printed out onto a piece of paper and you get it. And then you'll get it in your mailbox and you can read it. And then on the back of it,
oh, there's an actual mailbox.
Every cabin has a mailbox that usually your counselors or your unit leader will gather the mail. And then usually right after lunch, they give everybody any mail that they got.
Mm-hmm.
And then when you read your message, you flip it over and you can write on it, fold it in half and give it back to to your counselor. They'll give it to the office. The office scans it and it goes right back to your parents.
How do you scan it?
You don't have to do it. You hand it in. The office does.
Oh,
They have
okay.
a scanner. Yeah.
Okay, thank you.
Yeah. No, great question.
I just,
All right.
I just wanted to,
Oh, what's up,
yeah,
Megan?
I just wanted to say hi to Zach and Josh. It's been so long. And Mitch, of course, I was a camper there for years. I was a counselor, and now my daughter's going for the first time, and I'm super excited. And this was a great presentation. So thank you.
Awesome. All right. Thank you, everybody. Zach, Josh, Blair, everybody else, thank you so much. Have a great evening.
Good night, everybody.